Welcome to the PRovoke Media podcast. I'm Arthi Shah, Executive Editor for PRovoke Media and the host for today's episode. So today we kick off a three-part series with Allison+Partners called License to Accelerate: Perspectives on the Future of Health. So as part of this series, we'll bring together perspectives from across the healthcare ecosystem, mental health, devices, chronic disease, and more, to share sort of learnings from the past year. Because as we all know too well now, the healthcare industry has experienced a tremendous level of progress and growth that we haven't seen in decades through this pandemic. So the first episode ties with May being Mental Health Awareness Month. And we'll explore how the global health pandemic has impacted both awareness and action around mental health. So for today's episode, I have with me to hear Stephanie Rogers, who's SVP of Communications and Marketing at the American Foundation for Suicide Prevention. And I also have with me Michelle Webb, who is Managing Director of Health at Allison+Partners. Welcome, Stephanie and Michelle.
Hi there. Thanks for having us.
Thank you. Thank you.
And I think we're covering a lot of geographies here because I'm, of course, dialing in from the San Francisco Bay Area, and Michelle, you're on the East Coast somewhere.
Yep, a COVID refugee in Chapel Hill, North Carolina, by way of Brooklyn.
Very nice. I spent a summer in Chapel Hill, three PhDs. I loved it. Yeah, and Stephanie is joining us from Austin, Texas.
Yes, I'll be staying in Austin for the next few months. It's been great to be near family during COVID.
Yes. Well, welcome to the show. And I would love to get a perspective from both of you about your experience and what you've seen in mental health and mental health communications during the pandemic. Stephanie, of course, you have a really interesting perspective working so directly in mental health. So I'd love to hear from you. And then Michelle, if you want to talk about kind of what you've seen more kind of at a higher level around the issue. Stephanie, would you like to start?
Sure, I'll be happy to. Again, I'm Stephanie Rogers, and I'm with the American Foundation for Suicide Prevention. And really, during COVID, as a field, we've really been leaning into this conversation around mental health and the importance that we all have mental health and the opportunity to really care for it during this time. And so in terms of our work, that's really where we've really shifted our messaging and our attention, is giving people tools and language and ways of connecting with their friends, family, and in their workplaces.
Yeah, I would think, from your perspective, isolation has obviously been a big piece of it. And so how did that change? So, prior to the pandemic, what were you addressing mostly? And then how did that shift during the pandemic? And as we are slowly crawling out of this, where do you expect your focus to be there?
Sure. So prior to the pandemic, a lot of our work was, our sweet spot is really in suicide prevention. And, I feel like, as the pandemic began and became really a part of everybody's daily lives, we shifted our messaging more around mental health because we wanted people to understand the correlation between safeguarding your mental health, so that suicide or a crisis was never a challenge. And I think one of the ways that that shifted is really about just leaning into our workplace and our partnerships in workplaces and helping to guide them in terms of the way that they talked about mental health with their employees. And so what I would say as an organization is, while our sweet spot was really in suicide prevention, this opportunity to lean into mental health early and often was really the shift that we made. And now as we're kind of pulling out of the COVID and into this kind of new time, I think it's still the opportunity to lean into mental health. And I say this because we know that as people kind of recover from the trauma or the loss or the experience of COVID, it's really the time to really focus on self-care and to focus on, again, those conversations between your friends, family, and others, and staying connected to one another. So from a mental health perspective, I think that should continue to be a part of our dialogue, a part of our everyday. And so I don't see that going away anytime soon. I really see, as a culture, us becoming smarter and more comfortable in the space, and that's so good to see. And so I think it only gives AFSP and others in our space the opportunity to really lean in and to continue to educate people about the importance of those kind of issues around mental health.
Right. Well, that's I love what you said about the trauma and loss, right, that we all experienced over the last 12 months, and addressing that collectively. Maybe we can circle back to that as part of this conversation, as sort of, how can we collectively, culturally process what has happened and move forward, because I'm sure there's a lot of emotions that people are feeling as they're kind of coming out of this. Michelle, what have you noticed kind of over, from a bird's eye view around the way mental health has been addressed and talked about over the last 12 months?
Yeah, I think, I've been in healthcare for almost 20 years, and I've, like many other people that have been in this industry for a very long time, I've never seen this level of progress in this, highly regulated, slow moving laggard of an industry. And it's very encouraging. At the crux of it is obviously telehealth and telemedicine and the mass proliferation and uptake of that technology. And it's kind of transferring into every subcategory of health. You're seeing it in mental health, you're seeing it in tech, consumer tech, remote monitoring. It's kind of really got its claws at everything in the very best of ways. And people are kind of struggling. And I think it's a bit overwhelming for a lot of clients that we're working with, as well as just, longtime heritage players in the industry. But in terms of mental health, I think there's a really incredible conversation that is happening that is really kind of leveling the playing field for people. I think that it's starting in this kind of mainstream conversation. Hopefully it will spill over into more of a, higher acute settings where people are really dealing with some, challenging conditions like schizophrenia and, triggering homelessness and, all kinds of sort of more challenging places than someone like me who's experiencing burnout and at work and others like me. But hopefully it can really transcend all kinds of categories and be a conversation that we are very comfortable having at all times. I think there's been a real reduction in stigma, but would love to see that transfer over into the more acute conditions and homelessness and addiction, that kind of thing.
I also like that you mentioned, telehealth, and I'd love to at some point, we can talk about the impact that telehealth has had on sort of the accessibility of mental health resources. So but I want to first sort of address stigma, right, and talk about that. And that's been obviously a big challenge around mental health and even, suicide prevention. And, over the last 12 months, we've all collectively had this conversation about mental health. And I will say, and again, I don't know if this is geographically specific to being in the Bay Area, but I started noticing conversations around mental health even before the pandemic. I sit down with industry leaders in the PR space, and many of them were talking to me about bringing in mental health resources to their workplaces even before the pandemic started. So I'm curious to know, have the stigmas around mental health changed? And where are we now? What are the biggest stigmas at this moment? And are they different than what they were, even just a few years ago?
Yeah, so for AFSP, I started working with the organization 7 years ago in May, and I have definitely noticed a shift. In those early years at AFSP, it was more about keeping it simple and making sure that people understood what mental health was, what we mean by mental health. I think many of us do not talk about depression or anxiety using that language. We might say that we're, feeling sad, or that, a younger person might say, well, I failed this test, or I broke up with my boyfriend and I'm, I'm feeling pretty lousy, or they might be experiencing that, but not know how to express it with their friends or family, or certainly not in our workplaces. And I think what I've noticed most recently with COVID is this interest in talking about it and understanding it culturally. That's been really transforming the way, as a culture that we're addressing it. We work with media and entertainment a lot. And in the early years, we would call them and express our, we would say, gosh, I wish this program or that program would shift their language. And so we would try to have these conversations, and they wouldn't get very far, right? So, or even with journalists that were writing about mental health, but not always getting it right exactly. And so we would reach out to try to provide education. And that was pretty rough at first, just in terms of making the connection and them being able to make those changes in their work. Today, there's been so many incoming requests and interest and workplaces coming to us, large workplaces coming to us saying, how do we support our employees? How do we make sure that we're telling these stories well? And journalists really wanting to make deeper connections within their stories about how they're referring to mental health. So our experts are doing double duty these days in terms of providing that kind of context and experience. And frankly, I don't even, when I think of the word stigma, I don't even use it in our messaging ever. I try to keep a very hopeful, like upstream dialogue around mental health, because I want people to know that we all have it, that it's okay to talk about it. You think about, the time of when cancer and HIV had a lot of stigma associated with it, and we didn't talk about it, and how that shifted today. I think mental health is in a similar transformation. And it's, we know through research that the more we talk about mental health, the more we talk about suicide, it actually reduces the rate of suicide, and it actually helps support mental health too, in terms of accessibility and affordability, and ultimately it will save lives. And so I think this new open dialogue around mental health that we're having as a culture and within workplaces and frankly within the media and entertainment landscape at large is really going to shift the way we talk about it as a society. It's really great to see.
Yeah, I mean, I love the point about, there was a point where there wasn't a baseline understanding of what mental health meant, and we've progressed a long way. And now I think we're almost getting to this point where there's a universality, like the universality, I don't know if I'm saying that right, of mental health, right? That it touches all of us, just like we all, have to go in for a physical. We should all be checking in with our sort of mental health as well. And that seems like that's really picking up steam in a way that it hadn't. So, well, I guess, actually, Michelle, did you want to add anything around, stigmas? So then let's talk a little bit, about the accessibility that we're talking about, because one of the challenges around mental health from what I've seen has been the accessibility of it in this country in particular. Is that shifting, and is there, breakthroughs like innovations like telehealth, is that sort of changing the game around accessibility, or employers providing mental health services at a rate that, seems higher than before the pandemic?
So many layers to this. I mean, it's great that we're having a conversation about it, and it's great that so many employers are stepping up, but, when it comes down to the policies that need to take shape, and everything at the state level needs to be changed in terms of how things are reimbursed. I think telehealth is an incredible step forward, but again, I think taking this conversation and this progress to scale requires more than telehealth, because someone that is, again, deeply affected by mental health conditions won't necessarily get the same level of support or, help from a telehealth app that they would in person. So again, very complicated. I know AFSP is doing work there as well, but that policy issue is very tied to the access piece.
Right.
Yeah, I will just echo what Michelle is saying in that I think with COVID, telehealth has made it more accessible and possible for, and other apps. I want to give a shout out to the apps out there that are more accessible too. It's given people who would not typically consider therapy new options and a low point of entry. And telehealth was much harder to get access to prior to COVID. And so I think that's really been an interesting silver lining this past year. Is it going to solve some of the more kind of challenging issues around affordable care and access? It doesn't for people who are really struggling. I think, as humans who all have mental health, again, just as we would physical health, I like to say that a lot because I think people forget that our brains are another organ, and just like some people struggle with high blood pressure or cholesterol or heart disease, our brains need support and attention too. So I always kind of lean into this. Mental health is just as important as physical health, and we have to care for it the same way. And so I think until there's more attention through policy put on mental health and funding attached to mental health for all, we still have a long way to go, but we're making progress, and that feels like this is an important moment to just give a shout out to those telehealth and different what I would call self-care apps that we're able to access through our phones. It's really about reaching people early and often long before the crisis. And the more comfortable they become now with telehealth and the other options, the more likely they are to access resources when they're really, really not in a great place.
Yeah, no, I think that's really excellent points. This sort of that low point of, barrier to entry with apps, so people can at least sort of start kind of dipping their toes in. And then I love that point that you've made a couple times about sort of reaching them early and often before a crisis and how critical that is for mental health. Do you have any advice on what, a lot of our listeners here today are either, they're employers, they're obviously friends and family of folks as well. Is there any advice that you can give to people in terms of how they can ensure that they're for both themselves and for the people around them, that they're reaching them early and often before there is a crisis?
Sure. As an individual, one of the easiest things to do is just trust your gut. If a friend or a family member or workplace colleague isn't behaving like themselves, reach out and connect with them and ask how they're doing and how you can help support them, and really just listening and being available and kind of staying connected makes a big difference. But if you don't see changes, or if things don't seem to be getting better, there are free resources available 24/7. There's the crisis text line. You can just enter hello or I forget which one we use, but enter hello and then text 741-741. There's also the National Suicide Prevention Lifeline. That's 1-800-275-TALK. And they're available 24/7, free, anonymous. and we'll have a crisis resource on the other end to help. But for workplaces, one thing that has been really terrific to see, and kind of another silver lining during COVID, is how many workplaces are really putting an emphasis on mental health benefits and support in the workplace. And that's been very, very new too. I definitely saw it before COVID, but during this past year, during 2020, even more so, with real intention behind creating wellness days or mental health days, making sure that mental health was an insurance option or benefit, part of a benefit package. You've seen more workplaces giving space for conversations about mental health as part of an HR, like lunch and learn commitment, and conversation within the workplace. So I am seeing real changes there, and I think for workplaces to make that commitment to their employees, we're going to begin to see more and more of that in the coming year and beyond.
So looking specifically at that issue for our industry, for PR and communications, and I'd love to hear both of your perspectives on this. One of the things that I've heard from folks in our space over the last 12 months is, given how brutal the news cycle has been over the last 12 months, right? Whether we're talking about mass death, we're talking about racial violence, we're talking about political unrest. We're in a business where we don't have the luxury to unplug, right? We can't say, I'm going to just turn off and tune out the news cycle, because that's part of our jobs. So what advice would you give for folks in our business that, that taking that space is not necessarily an option, and they do sort of have to be, they have to expose themselves to everything that's happening, even if it does, feel like, overwhelming?
Yeah, I think, especially at Allison+Partners, we're having a lot of conversations and being very thoughtful in the way we talk to all of our employees about, truly unplugging when you're taking PTO in the evenings, certainly drawing some boundaries around client communication when you can. I mean, if there's an emergency, obviously we're kind of live and ready to help, but, making sure emails, because we're being contacted on every medium right now, right? Phone, laptops, practically coming to our door with ringing our doorbells with news. But being very purposeful in communications, and I think having managers be very well trained in how to protect the time of people that report to them, telling people and training them how to kind of push back when they can. It's all within reason, I think, but it's very possible. And I think when people really do get that opportunity, they come back with great ideas, refreshed. Morale improves. So it really has to be, I think, a conscious effort across the organization, in any industry, really.
Mm-hmm. So the other piece of this is, of course, social media, right? And I would really love to get both your perspectives on that. I mean, because on one hand, social media has enabled marginalized people to find communities, right? And that's been really healthy. And then, of course, we all know very well, like, all of the negative impacts of social media, whether it's comparing yourself to other people, or, having superficial contacts and not really fostering deep and meaningful relationships. So, Stephanie, this might be a good question for you in terms of how you've seen social media sort of impact mental health, and what sort of advice do you give to people in terms of how they can engage with social media in a healthy way? And again, specific to our industry, again, this is an industry where disengaging on social media isn't always an option. It's important for people to kind of be attuned to what's happening, both culturally with the brands that they represent. So yeah, I'd love to get your take on social.
Sure. So, I think social is good and bad. I think social is a great way for people to stay connected to what's meaningful to them and the people in their lives that bring them comfort or joy or hope or whatever that might be for them. I think for people in our field, it is important to unplug And I would say that there are times to do that for yourself, whether that's in the evening or there was a time. I come from an agency background myself. I spent 20 years in agency before I came to AFSP. And sometimes it was about taking the morning to not listen to the news and just tune in the evenings. Sometimes it was about taking on my days off, unplugging on those days. So I do think there's room to do that. I also think, in my work at AFSP, I'm now working very closely with the social good teams at Facebook and Instagram and also Twitter, and now we've added TikTok to that list. And their teams are putting in place new tools and resources and a process for helping people who may be struggling on their platforms. And they are also putting in safeguards that flag content that might be more triggering for somebody that's not in a great place. And so even for those platforms, I think they're really trying to find new ways of making those spaces safer. But I hear you. There's not a perfect fix, and for those in our industry, in the PR industry, I just remind you that self-care is important. Mm-hmm. Take time out to eat well, to exercise, to meditate, to journal, whatever brings you peace of mind and space in your life. Use those moments that you can. I find that my days are full of Zoom meetings right now. For some Zoom meetings, I give myself and my team permission to be off camera. Before the COVID, we were not all seeing each other 24/7. We had space where we just had conference calls. And so I really try to give permission for that. If I find that I have a 30-minute break in my day, because I'm sitting in front of my computer all day, I have my slip-on tennis shoes right beside my desk. I put them on and run around my complex here where I'm living right now, and get in a quick 10, 15 minute just walk with some fresh air. So I do think there are things that we can do even when we can't unplug from social media. So, take those moments and really try to find some space for yourself. It's important.
That's been one of the inspiring things I've seen. I did a piece recently, a 4-part series on asking people, this was women in particular, on how they've gotten through the last 12 months. Because obviously we know that, the pandemic has sort of disproportionately impacted women. And what was really inspiring was all of these little hacks that people found. One woman was talking to me about this 10 a.m. walk that she does, and she protects it. She protects this on her calendar. And 10 a.m. she just needs that. There was a CEO of an agency that said to me that she does a movie with her young children at 2:00 on Fridays, and she makes sure that everybody knows that, so they know that they should take that too. Like people that are balancing parenting and during this pandemic, they've been hit really, really hard. So I love how people have been able to find these ways of self-care, and how employers have really embraced that as part of the pandemic, and has realized that, people should, find those ways that work for them. And it won't be universal, right? If you have children versus not, versus whether you're, what kind of environment you're living in, it's going to be different. Michelle, this might be a good question for you in terms of is there anything that brands can do, as you're counseling brands to ensure, that they're addressing maybe in whatever way they can mental health or suicide prevention?
Yeah, I think, interesting announcement from Nike today. It just came out, kind of, putting some backing behind mental health for their own employees. I think as an employer, as a brand, employees have never been more important. They're obviously your number one advocate. So making sure that's part of the benefits package. Here at Allison+Partners, I think every employee has access to COM. We have a Wellness Wednesday, and I think brands large and small can be doing that internally, making sure they're communicating about it. In terms of, grand gestures by brands in the marketplace, we're seeing a lot of that. I think that, there is some real investment that can go towards programs, partnerships, making sure that people have access to services, transportation, jumping in on some of this as well, getting people rides to providers. So there's some really interesting things going on, I think, kind of all across the board.
So, we have to wrap up. So it's kind of my closing question is going to be sort of a two-part. And one is, we have gone through a major trauma collectively, right? Globally, but also, I think it's been really country specific, right? Every country's had a different experience. So how can we collectively sort of process the trauma of this global pandemic? And also, how can we ensure that the momentum continues, that, as we crawl out of this, we continue to prioritize mental health, and we continue to these conversations that for many people started during this pandemic. So I will open that up to both of you to sort of address sort of as our closing statement.
Sure, I can start. I think about the work at AFSP, and in particular, I'm thinking about this amazing relationship we've had with Allison+Partners, ANP, over the last, I guess it's been 4 or 5 years now. I get lost in the COVID year, but where I think the opportunity is continuing to tell the stories of people who have found purpose and resilience and their learnings through this. And so, for the work that we're doing together, ANP and AFSP, I find that when we're able to lean into what we call our content experts, those clinical perspectives at AFSP, and when we're able to lean into the personal stories of people from all backgrounds, here in the States and abroad, who have similar mental health challenges and different challenges, if we're all collectively continuing to open up that dialogue and that conversation, I think we'll see change. Michelle mentioned policy changes earlier. At AFSP, we have a public policy team in DC, but we also have what we call field advocates that are based in every community or within every state nationwide. And every year they go to their state capitals and advocate for legislation around mental health and suicide prevention. And I think it's important that we continue to do that. And it's my hope that change will continue to happen. I think again, progress has really been made in the last year, but I've seen a big shift in the 7 years I've been at AFSP, and in particular, the work that AMP and AFSP have been doing together. Just our monthly kind of effort to get the word out and to shape that dialogue. We're seeing change happen right before us. It's really great.
Right. No, and I think that's a great point. And like I said, from my vantage, I saw this happening before the pandemic, and that just accelerated it, which gives me a lot of hope.
Yeah.
This is a long-term cultural shift. Michelle, did you want to address?
Yeah, sure. So I think Stephanie brought up a great point about storytelling, right? You can have the best mental health product, content, et cetera, but if you can't connect with people, it's going to make it all that much harder to really bring that message home and give someone the inspiration they need, or, the kind of light bulb moment they need to go out and seek help or, just, start a conversation. So, really making sure that we're creating stories in this highly regulated industry for so many, an industry that's been pretty bad at it for a while. A lot of folks are emerging as, real kings of content here, but making sure that we are connecting with people, using real people's stories, bringing solutions to scale that can really make an impact, whether that's through technology or otherwise. But I think when it really comes down to it, it's about people and empathy and growing stronger together.
Mm-hmm. Right.
I'll just say one other thing too. One of our chief medical officer, Dr. Christine Moutier, she's also been training clinicians and primary care doctors in terms of asking the tough questions about mental health and really building that into the conversation that they're having with patients. And I think that's another avenue. So it's, while the work that we're doing as PR advocates and communicators, I think that's one piece, but then there are all of these other collective pieces happening at the same time that are working in concert with one another. And I just think the more that we focus on that, the stronger we'll continue to be.
Stephanie, I'm glad you brought that up. I mean, I think integrating mental health with sort of these physical health, which there's so much education and information about getting your mammograms, going through annual checkups, getting your lipid panels, whatever it might be, and to have physicians talking to their patients about sort of these mental health checks seems like a critical piece that was missing for a long time. So I'm glad that you touched on that. Well, this, of course, is such an important topic, and it's something that I'm glad to kind of put a spotlight on it in May, but I think it's a conversation, of course, we should be having year round, especially for our industry. It's a very high stress industry that, it's deadline driven, there's client service. It's just a high stress environment. I think correct me if I'm wrong, but I think that sometimes the most stressful jobs, PR is always like listed on the top 5, right?
Probably.
So this is a conversation that I try to have year round because I think our industry needs it. But I'm glad to, kind of give it some extra attention this month. So thank you, Michelle, and thank you, Stephanie, for coming onto the show today and talking about this. And I'm quite excited to, kick off this series on the perspectives on the future of health. I'm sure we'll be back soon with another episode. So thanks again. And I want to thank also our production partners, Marketeers. And again, we'll be back soon with another episode.
Thank you.
Thank you both.